Hi, this is Christina Hall, and this is my presentation on how colonization is linked to intergenerational trauma. So first we're going to look at the connection between intergenerational trauma and colonial injury. And basically what colonial injury means is the trauma that is experienced at the time of colonization and is then passed on throughout the generations. So in this case, the colonial injury would be applied to Indigenous peoples through the settlers of Europe who perpetuated conquest, subjugation, and dispossession. Furthermore, it is also evident in that the collective experience of these injuries by entire Indigenous communities whose identities, ideals, and interactions were radically altered as a consequence. However, although these experiences initiated at the time of colonization, the cumulative effects from these injuries as the consequences of subjugation, oppression, and marginalization have snowballed or continued throughout ever-shifting historical sequences of adverse policies and practices by dominant settler societies. So in this case, and in most cases, we would be looking at European settlers, predominantly white settlers. So as a result, cross-generational impacts or intergenerational impacts of these injuries as legacies of risk and vulnerability were passed down from ancestors to descendants in a process that kind of took the components of what was experienced at the time and further pass it down. So furthermore, one of the most evident forms of oppression that triggered intergenerational trauma as a result of the colonization of Indigenous peoples of Canada is the residential school systems. Furthermore, this form of oppression was kept in place by mass propaganda that painted Indigenous peoples of Canada in ways that masked the assimilative influences in which were altering Indigenous life forever. This form of oppression alone has generationally dictated the outcomes of relational connections, dynamics, and experiences, and is described through research that persists links between having an ancestor attending boarding school or one of the residential schools and the connection between adverse health outcomes such as suicide, depression, and sexual abuse. There's also a very heavy neglect found in mental health and physical health, in which is reflective in poor health outcomes in both areas. This is seen through the displacement of Indigenous peoples within Canada from their traditional land bases and the severance of their cultural connections from the land and traditional lifeways, and has resulted in social, cultural, spiritual, emotional, and physical disruptions, causing profound social and health impacts related to cultural losses, alienation, and identity disruption. So those are some of the mental health components of what has been passed down from colonization and would be considered part of intergenerational trauma. Furthermore, the disparities within Indigenous mental health and the structural factors that contribute to current mental health problems for Indigenous peoples include the disruption of traditional patterns of subsistence and undermining of community autonomy, the mass expropriation of Aboriginal lands and resources, and the creation of enormous economic inequalities. So now we're going to look at the social and economic impacts. So there very much is a perpetuation of oppression from the time of colonization, including discrimination, microaggressions. So that could look at everyday injustices and demeaning messages that marginalize Indigenous populations, as well as poverty and mass marginalization of Indigenous communities. There's also a very big focus on feelings of loss of trust and insecurity in governmental powers, dominant culture, and within one's own community, as we see in lateral violence within Indigenous communities. There's also an increased focus on criminalization as well as an occurrence of criminalization of Indigenous peoples. And this kind of connects back to how Indigenous people were portrayed in mass media as being uneducated and needing some sort of reform. And so that emphasis has been brought down through the generations as well. And now we're looking at intimate partner violence. So there are also currently heightened cases of intimate partner violence, and many are not reported. This is because there's a mistrust in the systemic level. So Indigenous peoples experiencing intimate partner violence feel as though they are often not going to be listened to, that this silence that's been perpetuated from the time of colonization is going to continue, and there's very much evidence to suggest that these mistrusts are to stay in place. And that is all.